possibly February, maybe more likely into March or a little later, being at a break-even point. Billing's being brought back in-house. It costs us a lot of money to have our billing done through Monida. There's been some pushback from them about backing out of that contract, but I think we're in a position where that's going to work. We're going to be hiring a part-time CFO for $40 an hour as opposed to paying $125 an hour for an outside guy to do it. Cindy and Larry, and working with all the providers, adjusting the provider levels so that we'll have providers staffing such that we'll see at least 2 patients an hour. Right now it's more down around 1 patient an hour for the number of people we have as providers, and that just doesn't work.
So is Wade not going to be replaced then? What's the total?
I don't know the specific personnel details, and again, Cindy and Larry are working that back and forth, and they're also working back and forth in terms of who's going to stay with the clinic versus who's going to staff the ER, and how that's all going to work. So I can't tell you specifics, and there are providers. The providers are being spoken with. Are you more interested in ER? Are you more interested in clinic? Which would you rather do? Where would you rather be? How do you want to divide up your time? And they don't have all the answers back yet, so I certainly can't specifically address that, but Cindy was looking at terminating the lease for the space in the basement at the health center, or the mental health center.
The blue building, right?
It looks like that's maybe going to end up, at least for the duration of the leases, with a reduction in rent as opposed to terminating completely, because they weren't real happy about that either. But it's just looking at every area and avenue we can to bring the costs in line with the revenue, and it looks like we're on track to accomplish that. So,
Okay. Thank you, Josh.
I don't know whether, Lloyd, you have anything you think needs to be added?
Well, other than we sold the Subaru
Yes.
for more money than we got.
We owed already, yes. We got
Not
out
very
from
much,
under.
but.
Yeah, we got out from under that. You don't buy a new car and sell it a year and a half later and make a profit on it. But we got out from under it. So, and again, we're looking at every expense. If it doesn't make sense, if it's not where we want to go, we're walking away from them as best we can.
Cindy told me that she really regretted, though, cutting out the coffee for the clinic. She's had a lot of comments.
Good, my Christmas present will come through then.
But actually, I was teasing her about that, and we had some discussion about that early on when I came, and actually Sherry approached me on this side and said we should do that on this side, and I said no, I did that once about 30 years ago, and I never want to go through that again. Montanans like their coffee, and it's not worth the pain.
And the anger.
Yes.
Yeah. Well, yeah, sometimes small things can be big things, and sometimes it's worth continuing the small things.
Right.
So, without a doubt. But yeah, the clinic is definitely working really hard on getting things in line, and really looks really positive to be able to accomplish exactly that. So, and I second Larry's approach. I don't know. Cindy must run on coffee actually, so I don't know.
Yeah, she doesn't drink much, but
Lonnie actually said it went up since I've been working down there. I didn't quite.
She's sure high energy, that's
I
for
put
sure.
it on,
does.
yeah.
She is, for sure.
I put it in one of my reports that she's a dynamo, and
Yep.
she really goes.
Yep.
Okay, let's go on to our board committee reports. Thank you, John. Terry, have you guys progressed anything on the bylaws? Not yet? Okay. Clinical outcomes.
But we will one day.
I know there's a list of changes that need to be made, but we'll let
Is
you
Terry
take.
responsible for the one?
Well,
Terry,
Jim.
Terry,
Oh, I had Jim.
Terry,
Yeah.
Terry and Jim.
Oh,
Well,
Terry and Jim.
They share the responsibility
he shows.
Oh, okay.
Um,
and excuse.
Terry is the committee chair.
Oh, okay, okay.
The only reason Jim was on there was because Terry wasn't able to make it last night. Okay, Gary, do you have anything for, QI committee?
Pretty much, like it says in our minutes we just approved, it says, this last week's meeting was missed due to ER. And, there's a feeling that there has not been enough provider involvement. So the last meeting was canceled because of that in the clinical outcomes. We've lost one of our champions in chest pain, Wade. So now, we're looking for providers in a couple of capacities. One in chest pain, and then someone who will be the champion provider for the clinical outcomes committee.
Is
I think
this,
Dr. Lovell has been designated as such. It's just that we haven't seen him.
We will not have access to providers after February 1st. Currently how it sits, Dr. Lovell is our chief of staff, and he's expressed to me that he does not want to continue working in the hospital. Dr. Pafford, we don't have a contract with him currently to serve as the medical director in the hospital, and his time will probably be limited. I don't see that we're going to have a clinical person on our QI committee.
how can we function without?
Well, most facilities didn't.
Really?
Well, yeah, we can talk about that in executive session. You know, we're employing an ER physician or mid-level provider. Actually, it's costing us more money to do that because we have to have that person in the hospital during the day after the first of the month, 1st of January, because they can't split time between clinic and the hospital, and there's certainly plenty of time when Dr. Pafford is over here. Well, I shouldn't say that because I'm not a medical provider, but there should be time. There should be time. There certainly have been in other facilities that I've been in of this size. When that physician is doing,
It's dedicated to that.
yeah, is dedicated to the hospital, that they can perform medical director duties and QI and QI. Those kinds of duties. Administrative type duties,
Well,
medical director
this is
duties.
something we have to have somewhat like,
I do have to work it out with,
Yeah.
with Dr. Pafford. You know, Kirsten is exactly right.
Right.
You know, Cindy has pretty much nailed down those contracts on that side. My commitment, because I was gone last week, I couldn't keep up with her dynamo pace. And my commitment to the medical staff is to get those of, Laurel and Dr. Pafford are gonna be crossing over. And so I'm setting up a template, for, plus the other three, Brian and Frank and Rick, right? Right. And KT too. If she continues, we're not quite sure what's gonna happen there, but
Yeah,
but,
that's the case.
but, those templates will cover the work that they do 24 hours a day, 365 days a year, at a very expensive rate, by the way, to cover the hospital. And also some duties are changing there. They'll be doing hospital rounds, inpatient rounds and long-term care rounds, which Cliff is very happy to report that the revenue is also coming over, from those services, that used to be on the clinic side. So the blow is softened a bit for the daytime ER coverage that we have to purchase. But anyway, the long and short of it is that I have work to do this weekend. I'm staying in Superior this weekend to do that and some other things, but, my commitment is by Sunday, Monday morning at the latest, I will email all of those providers that draft contract, that template that's the same. And with Dr. Pafford's contract, with this issue that we're just talking about, you know, we have to have some discussion and some, you know, and some building of, you know, an understanding of what, you know, what the medical director duties on the hospital side are gonna contain, you know. You know, you're right, we have to have a medical director, we have to have a chief of staff, so. We'll be handling that in the discussions with you.
Well, and quality improvement is important.
Oh, it's
important, and
very
for the
important.
second month in a row, because there hasn't been provider attendance or engagement, it's kind of in a hiatus. Is that what I'm hearing, or is that?
Yeah, no,
is-
we've had,
is that-
oh, you mean on the quality side?
Yeah,
Okay.
Yeah, I think
I
the
just-
last one, there was an emergency in the hospital, you know, so you could use that as a good reason
that's a good
for
reason.
non-attendance. There were several of us that have attended the meetings that were non-providers. We just couldn't do too much, you know,
Yeah.
without that input. So.
Yeah. Guess there's some things that need to be worked out.
Right.
Yeah. Okay, anything else? Thank you. Marketing committee. Carol? Do we still have a
As
marketing
far
committee?
as I know, they started trying to have a marketing committee meeting in July.
And nothing,
Never have been to a marketing committee meeting, ever.
that's right.
Who's heading
You know
up
what,
that?
originally it was a
Monty.
joint venture with Monty and Karen, right?
Monty and Karen,
And it was, yeah.
and
I don't-
Deb Quick and I never have had a
Okay.
meeting.
We might need to,
Well, I think maybe that's being moved around, cause it's kind of a moving target too, of who's doing marketing and who has.
yeah, we might need to kind of put that a little on hold.
Mhm.
I mean, until
Correct.
something gets nailed down, some of those other priorities we
Yeah.
deal with. Okay, customer satisfaction committee, is that?
Well, we've
You
had
guys
faithfully
have-
for a long time, every Thursday morning. But now with the next gen craziness or whatever,
Our next meeting will be early January.
Okay. Professional affairs committee, we don't have anything this month. Next month we will. Unfinished business, we had a draft CEO job description that John, I thought did a really good job at getting going on that.
Yeah, I guess the next question is, do we wanna try and hash through that here, or my thoughts is, and we had indicated in the last, meeting that we'll set up a committee and have separate meetings to talk about that, I think is the best. You know, I think it's, what I've done as a starting point, there are a lot of things in there that very clearly I think we need to make decisions on. I just threw something in sometimes to fill in the blank with the clear, and I tried to note it where I thought of it, the idea, well, this is what I'm filling in, but we need to talk about it, and
Right.
it's not,
Well, would you be willing to head up that committee?
I can do that. Decide who's
I
on it,
guess we
I'll
would
call a
have to-
meeting and we'll keep going.
We probably need a motion to set up a committee.
I'd make a motion that we do set up that draft CEO job description committee,
Or,
Yeah, I'll second.
okay.
or whatever you wanna call it.
Yep.
Okay, all in favor of setting up a committee for the CEO description, job description?
Aye.
Any opposed? Okay. Can I make a motion as chair?
no.
You can ask for one, and suggest what you'd like.
Oh, well, then I would entertain a motion to make a motion for John to be the head of that committee.
I don't think we need to do it as a separate.
You appoint that, as a chair.
Yeah.
I can appoint that?
Yeah.
Okay, then I appoint John as the head of that committee. Is there any volunteers?
Could I be a part of that too as well?
I think
Yes.
that's probably a good idea,
Yeah.
actually.
You know,
Yeah.
I've been through that process a
Yes.
few
Yeah,
times
no,
with
I-
other facilities. So.
Whether you're on
Maybe I
the
can help
committee
you.
or not, I would want your input.
Okay, great.
Yes, yes.
Without a doubt.
I'd like to
Know what
chat
those
with
other
you folks
duties
about it, I
sounds
guess.
like.
Yep.
Okay, so Larry and John and,
I got a bunch of stuff that
You
on my
know,
computer,
I-
I think that might help you with some of it.
I would like to volunteer myself, if that's all right with everyone. Anybody else that would like to be part of that?
If you want, there's that.
Tanya? I think that's probably good.
Okay, why don't, and just to keep it rolling right along, why doesn't everybody by tomorrow morning, email me with their availability over the next couple weeks, and then we'll figure out a time.
I could tell you my best time is early afternoon. Baby's napping, and my husband can get work done. Otherwise, I have to find a babysitter. Okay, anything else with that? I guess we'll get moving on that even
Yep.
further. I thought you did quite a very good job so far on this. Okay, revision of mission and vision statements.
The leadership team, kicked around the existing mission statement. You know, we do have a lot going on, but we just felt that there were a couple things in it that really needed to be there, especially with the current situation, I guess. But even certainly a longer term vision, you need to have that statement in there. I think the leadership team thought in terms of cost-effective healthcare. You know, most mission statements that I'm used to, you know, vision statements have that in there. And I guess I'll just be blunt with this next comment. You know, it had a greater number of community members. You know, it's like some of the comments that we heard from the town hall meetings was that the organization was getting kind of big for its britches. You know, we really don't need to be serving, you know, Coeur d'Alene and Spokane or something. You know, and it was the consensus of the leadership team that that should come out, and you know, our focus truly is the people of Mineral County and visitors. I think that's visitors is very important.
I think that was the intention.
Okay.
But it's vague. I mean, with community, I think that was the intention, but it's really vague.
Oh, I see. Oh, I see. It meant you know, the Mineral County community, or you know, that was your scope. You know, so. But you know, for whatever it's worth, it's certainly a draft, and we just felt it was important if we did change those things, we needed to talk to the board about it. And
I like the word accessible.
Oh, yeah.
Somewhere in there. You know, I don't know where it would fit, but.
Cost-effective, accessible healthcare to
Somewhere, so we can tell the
Mineral County
community
citizens and
that, hey,
visitors.
we're here.
Yeah.
And accessible, ready to meet your healthcare needs.
That's a good,
Yeah.
yeah, that's a good addition.
Yeah, great.
Yeah.
So it would read then, to deliver cost-effective, accessible healthcare to Mineral County citizens and visitors.
You know, I think it's good.
Instead of citizens, residents?
Yeah.
Since it sounds like if you're not a citizen, I don't know.
They're not
It
residents
sounds
either.
so, I don't know.
We use patient up in the other, in the mission statement. I thought patient would belong in there somewhere in the vision, but since we used it in the mission statement, it probably doesn't have to be in the vision.
I'm not troubled by the word citizens
No.
because we follow it with and visitors.
That's
So
true.
you're one or the other.
That's true, no, that's
yeah.
true.
If you're
Well,
here, the minute you come across the border, you're
Well,
one or the
I was
other.
gonna say that's the first thing that comes to mind when I hear citizens, like, oh, what, so illegal, we're not gonna treat illegal?
No, and
Illegal immigrants, that's what I'm thinking of.
No, it says visitors too, so I mean,
Okay.
it's, yeah.
I guess it's okay.
No, I think it's fine, actually, and a comment along that line, and, you know, at first I wasn't sure about it, but the more it's happened, I like it. Cindy's adopted the policy of, at the start of every board meeting, or committee meeting for that matter, the chair reads the mission statement. And I think that's a good idea, just to kind of remind you what we're here for.
Yeah.
So.
Well, I noticed when I first came that Mitzi was printing it on your agenda. And
Yeah.
we didn't do that last month because we changed the agenda all around, but she and I had some discussion that after we finalize this one, that we could certainly do that, or put it back
Okay.
on the agenda.
Yeah, that was good.
To remind, in the same purpose, to
Right.
remind you of what we're here for.
Yeah, let's not lose sight of that.
So is everyone comfortable with this?
I'm comfortable with it as revised, I'm prepared to move we adopt it.
I'll second.
So is that
Okay.
a motion?
Mine was a motion.
Okay, Lloyd
Lloyd
seconded. Is
seconded.
there any further discussion, any other comments? Okay, all in favor in changing the vision statement? I guess it's not a vision statement, it's just a vision.
Mission statement.
Yeah, there's no
Yeah.
change actually to the mission.
Right, vision statement.
Okay, yeah.
Okay,
Mission
all in
sta-
favor of the change in the vision statement?
And that's to be clear with the word accessible added that
Correct.
Gary suggested. Aye.
Aye.
Any opposed? Okay, motion carries. Okay, next item, CEO check signing purchasing authority policy.
Well, yeah, Cliff and I had some discussion when we were working through the budget. Oh, that wasn't part of the packet, was it?
We got it,
We
I
did
think.
Oh, you did?
Yeah.
Oh,
Yeah,
okay.
we got it.
Okay, you're looking at. You know, it's my understanding that I have check signing authority up to, the CEO does, up to 10,000, checks over 10,000, second signatures. And Cliff told me that, you know, I have authorization to approve a purchase, purchase order up to 20,000. That's not unusual with some of the size of some of the, contracts or, or services or supplies that we, equipment that we order in hospitals. And so I just wanted to clarify it in writing, make sure that I'm doing the right thing in terms of the board, that I have those authorities.
Did
And
you look? I thought there was a policy.
on the purchasing authority or the 10,000?
On the purchasing authority. Is this a revision?
Yeah, well,
Or is there no policy in there?
I'm not aware of any policy on the purchase part, on the purchase is up to 20,000.
If there is, it's way back.
Way back, yeah, Cliff thought it was way back,
That way ever since I've been here.
Yeah.
and he's been here 15 years. We gave him a 15-year pin at the
Oh.
Christmas party
Really?
2 days ago.
And a certificate for a psyche valve.
Congratulations.
Congratulations.
It makes sense that we have this. I don't.
Is there a
I-
Well,
requirement
it's
that you
pretty
disclose the
standard.
results?
Yeah, I mean,
Or
it makes sense.
accept this,
And who's the second signature? It doesn't specify who the second signature would need to be.
Well, you have approved that by board resolution.
Okay.
Right. You did that, actually, you changed some of the
We did, I
signatures
didn't
when
know
I
if
came.
that needed to be,
Oh, it's separate.
Is it separate?
Second
Do-
authorized signature.
yeah.
Reading it somewhere.
And then I did add in there, and every place I've been, hospitals are, I mean, this is a very typical scenario that there's something that's emergent that is definitely, needs to be fixed quickly, or ordered quickly, or purchased quickly because of, some life-saving emergency. The tube craps out on the, CT scanner or the x-ray machine, which is one thing we're gonna talk to you about here today, but a little bit, but,
Could you at least notify the board? I mean,
we can, sure.
as part of the policy?
Oh,
whether-
well, after the fact, I mean, right?
Or even just saying, this happened when you're doing this, because it would fall under, if it would fall under that life savings,
Right.
where you wouldn't necessarily have to have the approval right then, I think that's impossible, and that's the reason you have it in there, but notification would be nice to have,
Well,
just a notification.
Oh, but yeah,
Remember, the executive committee under our bylaws has the authority to act on behalf of the board in between, so all
Quite
you
true.
would have to do is make the contact to the executive
With the
committee.
executive,
okay.
Which is just
right,
two of us, isn't it?
yeah.
You say after the fact or prior?
Simultaneously, I mean,
Yeah, I mean, you don't have to have a meeting, that could be a
Yeah,
phone call, that could be
just-
5 minutes,
yeah.
you know.
Okay, at the same, well, really, it's prior, it should be set up prior.
Yeah,
Well, I wouldn't have a problem if he would make the call, to buy that, get
Yeah.
it going, then call you guys later.
yeah, I don't have a problem with that either.
But I think other than the dollar value, I think the executive committee should know that we have a piece of equipment that is life-threatening now.
Yeah,
yeah,
Risk.
Yeah, we got a risk factor.
yep, yep,
You guys should know that.
I agree.
Can we just bring this back to you next time then?
yeah,
I'll,
and I like that second
I'll
paragraph about
redraft.
obtaining board approval for any new
well,
program.
Cliff suggested this also.
I like
You've had,
that.
well, you've had problems with this in the
We've had a
past.
lot of problems with that,
Right.
yeah, I appreciate that being in there.
That's why it's there. We
Thanks,
got it.
Cliff. I would have suggested it too. I think all of us would have, yeah.
Well,
Okay,
You wouldn't have any trouble with me with any of that, that's my normal, piece of business, but,
Right.
well, you can run into an inexperienced CEO or something too that's not been through cycles and have the same issues, so it's just better that it's spelled out in writing,
Yep.
and that's why it's important to spell it out in writing.
Agreed.
okay, so are we ready to move on to the next item? It says motion to remove James Patterson from the board, but it's more of a drop. Just want to go to our bylaws. There was a meeting, Lori and, the county attorney, and Jim was supposed to be there, but he didn't make it, to find out how to deal with that situation, and, correct me, if I say anything wrong, but from what I had understood in that conversation was that we can go ahead and go according to what our bylaws say, and, one of the things that we will do, well, let me just read this, and then we'll have some discussion about this. In section 4.6 of our bylaws, attendance, it says any board director may be dropped from the board if they miss 2 successive meetings, or a total of 3 in the calendar year without a valid reason. It's up to the individual director to contact the hospital administration or the board chairman with a valid reason for non-attendance, and the board of directors will determine the validity of the excuse by majority vote of the board. He's now missed four meetings. And, we're at a point where we need to, have a replacement, so what the attorney recommended is that we need to have a motion for that to happen, and then we can start collecting applications for the board membership as well as advertising, and prior to our meeting next month, if we leave it open and we have it advertised to be accepting applications until maybe like a week before the next board meeting, that'll give us some time to go through them. And then at the following board meeting, we'll have a public section prior to voting on whoever we appoint for that interim, for that temporary spot until the election. But we'll have some public comments so that, because it is elected, so that we have some public input on who will take that spot.
And it's the 2-year term?
It's actually, cause last May when he was elected, it was a 2-year term at that point. So it would be appointed until the election, and then it would be a 1-year unexpired at that point.
Okay, so the next election, we're only appointing until the next election, not for the balance of the 2-year term, and then it'll go
Yes,
back
I
to the election.
know that.
Yeah, so it would be an additional 1 year.
Yep, okay, alright.
I so move.
Second,
Okay, any discussion? All in favor of dropping, Dr. Patterson from the hospital board?
aye.
Any opposed? Okay, motion carried. So what I have, for anyone that's here, anyone that's interested, I have some applications for the board, and Mitzi, if we could have people, could you put together, an ad for, who's normally in charge of putting those ads in the paper? Is that something that you do? Monty does it? See, he's not here. Can I have you pass on the word that we can, if we can advertise that in the paper, and then if we can put together if you could put together an announcement that we could post in our normal spots, that there's an opening?
We can help you with it.
Yeah. I'd like to get that up as soon as possible so we can get started on that. Is there any discussion? How does that sound to everyone?
Yeah, no,
I
I
think
mean,
it's
we
reasonable.
need to put the word out to the public, we need to see who's interested and go from there.
And
May I make a suggestion?
yes, please.
This goes back to Cindy. On the recruitment side there, we wrote what it means to be a board member task. So that would go with the application. So the individuals would have some idea what it really means to be a board member, rather than just,
As
Wish
opposed to
somebody
being
would've told me
as
what it was gonna
as
be.
opposed to
I mean,
because right now the way it's worded is if you're willing to attend the board meetings and if you'd be available to attend the
you want my
special.
certificate? This is the whole page.
It's a full page.
71 hours a week, phone calls
I
at
think that's
midnight.
reasonable.
Why don't I email it to you, then you can take a look at it?
Yeah, cause I think that as we get applications in, I think we should make contact with all of the applicants to kind of, talk about that. And hopefully we could get everyone here at the next board meeting. That's
Now,
interesting.
we should also have a central place that they go to, someone.
I thought
or
Mitzi-
Larry or somebody.
Yeah, I thought Mitzi might be the most
Yeah.
logical person, to hand those in and to get the
Well, and I can,
applications. And I can, certainly email, I mean, I have it electronically, so that if anyone approached board members, that we could hand those out as well.
Yeah, why don't you, when you get it put together, actually just email it out to any one of us, so if somebody comes to us, we just pull it right up on the computer
Sure.
and can hand it to them,
Sure.
rather than say, I'll get back to you tomorrow.
Yeah, I hate them, really.
Yeah, so we'll just be there on an email attachment, somebody contacts us and we can hand it out.
Okay.
And as board members yourselves, you can figure out who would be good and talk to them as well and see if they're interested.
The one thing we may wanna do is if we're gonna send out the application and job, let's say a job description, if nothing else, okay, that we should tell Mitzi that we have sent it out, so she would be expecting it. And if somebody doesn't, we don't have anybody else approaching that person if they don't. If they receive it and they don't wanna fill it out after reading what it takes to be a board member.
Yeah, I don't understand what you're saying.
Let me rephrase. All right, let's say that
I understand.
I received one there, and you know about that same person was interested before for there. Okay. If I've already sent an application, you should know that I've done it. So if we have a central place that gives us a list of
Oh, who's applied?
who has applied,
Okay.
Or
or
been
just requested.
contacted.
I'm just keeping communication.
Yeah.
Is Patterson a district member?
Yes.
Yes,
Yeah,
love
he
you.
was elected, that's right.
Yep.
Yeah.
But doesn't the state law say that when it actually comes to appointing him, that it's the 5 or the other 4 district members, or is the whole
That's
board?
why I went to the
That's-
county
yeah.
attorney, I didn't know what the rules were,
That's why we
and
asked
that's,
her.
so,
the district appoints it.
so
Right,
it's just. so
the other
So then-
district members,
So it's just the
not
district
the
members that
corporate
would
members,
vote.
right? That's the way,
Okay.
I looked up the law too, actually when I was traveling.
Thank you for clarifying that. So that
But-
would be 1, 2, 3, and then Jim.
You know, you certainly all can discuss it
Yeah.
and stuff, but the
Yeah.
authority really lies with the other district member.
Yeah, and I think.
So we
That's the
need
way
to
I
make
read it.
sure that we have enough for a district quorum at the next board meeting.
Yeah, you'd have the 3 of the 5.
Yeah,
Yeah.
so,
Well, there's only 4 left though.
right.
So two would be the quorum, I guess.
I already know I won't be here. I'm gonna be in the Galapagos Islands.
Oh.
Rubbing.
Swimming suit? You have a
Chasing
swimming suit?
turtles.
We don't know what day it's gonna be yet.
Oh, yeah, we don't have meetings in here.
Lori, thank you for doing that. Appreciate that. So are you okay with that, Mincy, if we have the applications come to you, to have it all centralized? And, and make sure we know who's,
They'll do it.
yeah, and just let us know when
We'll
you
do
come
it,
in.
sure.
That'd be great.
No, I mean, I know somebody good as a member.
Oh.
Okay.
Do it.
Oh, sure.
Okay, if there's nothing else on that, let's move on. Confidentiality, conflict of interest statements, I haven't gotten one from Terry yet, so I have
Really?
some,
Maybe I have some conflicts of interest. I don't wanna give it to you.
you don't wanna give it to me?
Just a little.
So Laurel already left, but I think the ex officio members should do it as well. I actually have some, so I will make sure Laurel gets a copy of that too, but I have
You
one.
have one, I'll
I have one for
give
you,
it to you.
and I went through all these last night to see where we were at. So there's two, there's the confidentiality one, and, hand it to Lori. And then the conflict of interest statement. That's all I had from that, is that we just need to make sure that we're all up on that. Very good. And that's all I have. Here's this one. Lori? Here's the last one. That might take a minute.
Is this different?
One's conflict of interest, one's confidentiality.
And I just realized that, the confidentiality, I was looking through, and I'm like, I don't even know whose signature this is. It was your signature, I was like, who's that, until I compared it, I was, oh, it's John. So you could just print your name on it as well, so I know who it is.
There goes the deniability.
Down to two.
Practice to be a doctor?
I know, that's what I was gonna say. Not lawyer trained.
I'm sure you're a doctor,
Yeah. Okay, so our next item of business, we have our revised 6-month budget.
Well, I'll just go back to the, what I was talking about earlier, I guess, and kind of talk about the last piece of that little summary that I put in the CEO report that, we have produced this budget, 6-month budget, to get everything in balance, as the health center has, as the clinic has. Our goal is to get our payables under control and pay down debt. I did give the board a rather shocking piece of paper that had the amount of debt that this facility has, which I was absolutely amazed at the numbers on that sheet. I was quite surprised with some of it, actually. But, we need to get that under control, and that's why we're, doing some of the things that we're doing with the budget, with the 6-month budget over the next 6-month period. We did do it very carefully, very deliberately. We looked at supplies, materials, contract expenses first, tried to squeeze out as much as we could. We did squeeze out some things in those arenas, especially with lab reagents and some other things that are down because of lower volumes. And certainly patient care is the last thing you want to touch. Folks that do provide direct patient care. And I guess the bottom line, kind of is with that last sentence there. It's I view it, Cliff views it, the leadership team views it as a belt tightening budget, not a major across the board workforce reduction, but it does have some job cuts in it, a couple of job cuts in it. I don't think in open session it's appropriate that we talk about those job cuts. at all, or even which departments they're in, because they're not official, you know. It's the board's responsibility to either sprinkle holy water on it or not sprinkle holy water on, you know, on those recommendations that Cliff and I have, and Stacy and Deb and Kirsten have, you know, put in, you know, the recommended budget. And so with that, I don't know much more, what I can say much more in public session, I guess, about it. You know, I think that's probably as much as we can, you know, get into without drilling down into the detail, which Cliff and I are prepared to do, and Stacy are prepared to do. Maybe one thing before we do go into executive session, I guess I would think that would be the next thing that the board would want to do, and you know, spend some time with us about it. But one of the things we did do, and I think it's perfectly appropriate that we may talk about this in open session, but we've recommended some changes in the employee health insurance, not as significant as I thought we were gonna have to do, but maybe Stacy in open session could just quickly kind of summarize those, you know, where we, all of this it's been such a tough year with the Affordable Care Act, you know, you talked about that earlier, but there's just a whole bunch of, everything was delayed, we didn't get bids back, and, you know, Stacy can talk about that, but kind of as a result of that, we did not do too much. We did a little bit of stuff to change. We changed it a little bit with, you know, with health insurance, but not a huge amount. But, you know.
Well, it was a nightmare getting back our proposals. We just actually received them Tuesday, I wanna say. I can't remember. And, so we were able to look at it and see what we have. It was actually, came from TPM, which is our existing carrier, and it was a 6% across the board for both of our plans. We have a high deductible plan and a, PPO, $1,000 deductible plan with co-pays and that type of thing. And it was 6%, which is a lot better than we anticipated.
6% increase?
We were looking at, I mean, the rest of them that we had received had been between 11 and 30%.
Oh, gee.
So we actually had received one back from Blue Cross that was a 4%. It wasn't, the plans were not the same. There were quite a few differences. In fact, the lower deductible $1,000 policy had gone to a $2,000 deductible type thing. So our agent had gone back to TPM, who we're very happy with, and negotiated with them for a 6%.
Also, we were concerned that, you know, Blue Cross would probably sue me or something for saying it, but I, you know, will say it anyway, that, you know, the history of this facility as well as others that I've been in certainly is that Blue Cross will come in, Blue Cross, Blue Shield will come in, you know, yeah, they'll give you a 4% increase, you know, first year, and then they'll cherry pick the business, and then, you know, a year later it's 30% or
Yep.
40%.
Seen that elsewhere as well. There's a
Right.
come on rate the first year, and then
Right.
boom.
Right, so.
So we felt a lot safer.
We've had that, well, as I understand it, this facility's had those experiences with Blue Cross Blue Shield in the past.
Is
They
there,
felt much
So the
more comfortable
increases
staying with
actually-
TPM.
The contribution from the hospital actually stayed the same as last year, and the employees are absorbing that increase.
which is,
Yeah, so there is a hit to the
Good idea.
employees.
it's not ideal, but it's not unusual for, I think,
Right.
everyone.
Right.
I
It's,
believe Tricom actually did the same thing.
yeah, it's gonna, is there,
Did they?
is the PPO plan, that's not considered a Cadillac plan at this point, cause I know, well, I was just thinking at my husband's work, they're getting rid of the PPO stuff because it's too good, and it doesn't fall under Affordable Care Act regulations. It's not, it's gonna cost them an arm and a leg. Is that gonna be a problem come 2015?
You would think the broker would have said that to us. I mean,
Okay.
we rely on the broker to paying to, and
To
that
let us
wasn't,
know if there's
that
gonna be a
wasn't
problem
said,
with it.
That
it
was
wasn't
not.
said. So.
Okay, so maybe because it has that $1,000 deductible, it doesn't fall under that category.
It's
I don't
not
know, I
so
just-
much, it's not so much that usually as it's
Is it?
things like we're covering all the electives like cosmetic surgery.
Oh.
Those
Is
are the
it?
Cadillac plans that,
Oh.
you know, the ones that cover things that people don't need to be healthy.
forward into next year, we're gonna be working more closely with our employees to form an, insurance committee where we can work together to kind of get where we're going and drive our broker that way instead of just having them come to us in the middle of December and tell us
And-
what there is.
Everyone has access to a health savings account?
On the high deductible
On
side.
how they do, yes. Okay.
That would be our strategy longer term, to try to get the employees to come off the PPO plan and go to the high deductible health plan, and then help the employees, build the, the
Do some kind of a
required.
match or something.
Yeah,
in the health
somehow,
savings.
we need to kick this around, and figure it out, but, give us some time to figure that out. And, but to build the health savings plans that are required, to handle the high deductible, especially the lower paid employees. The lower paid employees, it's a real difficult for them to accumulate, the health savings account amounts, but, we've been, Deb has some experience with this, claims and Angie's the president of the union, and we have actually have a clause in the union contract, right, that requires us to, discuss these issues and work them out with the union, so, yeah, we'll get it done, over the next year. We were, based on the numbers that Cliff had in the budget, actually, we ended up, we had some money planned, for health insurance increases, and it was less than that, even with what we did in keeping the rates, the employer contribution the same, the employer contribution the same, so, we're happy, and it's a little bit more burden on the employees, but it could have been a lot worse, believe me, we were talking about maybe decreasing that employer contribution, what, $50, $60, and that would have been really difficult, and I think we need to get there somehow, but, to make the numbers work in the budget, but, we need to keep at that, but, it's just gonna take us a little bit longer. We need to give our people, time to deal with those things.
One thing to look at, and that came up in the health center's analysis of the whole thing, and it's probably not at a point where it can be done this year, but just in terms of the timing. But what the health center found is that it was probably better for a majority of the employees to let them go out and buy health insurance on their own, taking what subsidies were available, and then the employer providing them a stipend towards paying for it, so that they actually ended up coming out ahead between what they got from an employer stipend plus what the subsidies were. Just something to, and maybe it doesn't work that way for the hospital, but
No, it
something to
doesn't.
look at.
Because of the employee numbers.
Right.
Yeah.
Yeah.
Right,
Because the health center has.
Yeah, they're
not as
under,
many
right,
employees.
They're under
that's
the
right.
50
They're under the
employees,
50, so,
you can do that if you're under the 50
okay,
employees,
and that's.
but you have to offer insurance.
But one option, going forward could be to say, well, we're only gonna cover employee only, which would allow their spouses and their children to shop the marketplace and receive a subsidy, because at this point they cannot.
Right. That was a huge issue with a lot of our people this last week. Lower paid, in most cases, well, everybody, it's, the affordability of insurance affects everybody, not just lower paid employees.
Yeah, don't misunderstand my comment when I make that. I don't want to say that I would not like the idea of us not continuing to make insurance a way to get insurance available to our employees. I think that's very important. I think that's the worst thing a hospital could be doing is.
Yeah.
As a hospital.
Exactly.
So I'm not pushing that direction at all, and I don't want to be misunderstood in that way. I feel very strongly that we should provide a way to get the insurance.
I would just say one last thing too, that this is a really rich plan compared to most hospitals. It's very, very unusual anymore to find a hospital or healthcare organization that pays 100% of the employee coverage. Just is.
I think that's true of any employer.
Yeah, yeah. Yeah,
That's
it's,
where-
yeah, it's a real strong motivator to have people work here, and, you know, and we have a good quality crew too. I mean, you know, so, I mean, that's all part of it. You gotta take all those factors into consideration when you dink around with those benefits.
Yeah, and again, my comments are not that I wanna start taking benefits away from
Yeah,
people. I'm
me
looking
either.
at the way of finding the best way for everybody to get there. I don't wanna do that.
Right.
Okay.
Executive session,
Well, let's,
is there something else?
for the good of the order, does anybody have any for the good of the order? And then we need to set our board meeting for January. When is the fourth Friday? Wait, is somebody on a calendar?
I'll do it,
Yeah,
When are you gonna try?
That's probably good.
From the 17th to the 31st.
oh,
16.
wait, when's the fourth Friday? It's not
January's
on
probably
there.
not on there.
The 24th.
The 24th?
Smart movie.
So,
January
yeah,
24th.
the first is Wednesday, so the 22nd would be a
24th.
Wednesday.
So the next,
23rd.
according to that, our
You
next
said the 24th.
board
Tanya's got a
meeting,
calendar. It's the
24th.
24th.
That's right.
the next board meeting will be
Tanya's sitting
January
here going to
24th at
24th.
noon. January 24th at noon. Everyone got that?
Got it.
Okay, are we gonna have a financial at 11?
Yes, we will, but.
And the auditor should be here, right? For our
That week.
January meeting.
I doubt it.
It won't be till February.
Until February.
Okay. Yeah, 'cause we didn't have a finance this time. It's your call, Lloyd.
I would like to have one
Okay.
preceding the meeting
Okay.
Sure.
until further notice.
Sure.
Once everything starts smooth enough. Then we can follow along. That way we don't have to take so much time with the regular meeting.
All right, with that, we will adjourn to executive session.
Amy, can I have an answer to my question at the end of last meeting?
Remind me what your question was.
As for the total amount spent for the new hospital to be closed at the next meeting,
So.
and that including, does it include what Innovation Grant refused for Stephen George's trips of whatever they did for the new hospital that are being charged back to you?
Well,
Pretty
there-
sure that it does not include that, but
Well, anything with innovations, it doesn't have anything to do with this whole.
Yes, it does, because you're getting the bills back for Innovation Grant refused to pay for the trips that Steve and George made to Washington DC to hire lobbyists, etc., to get this new hospital built. Innovations Grant refused them because it wasn't part of the grant, so they're owed by the hospital. They're referring them back.
I have not,
We haven't seen any bills.
we haven't seen any, well, and maybe John could answer that question. I don't think the health center has even asked the hospital to reimburse any of that.
No.
I would think
what-
the Innovation Grant would demand their money back.
No,
Well,
Innovations
They're banning
Grant.
it from the health center.
Yeah, Innovations Grant has got their money back, okay?
Where'd they get it?
They,
The health
they
center.
got it from the health center, okay? I don't know whether those numbers were figured in the balancing back and forth between what the hospital owed in, the health center and what the health center owed the hospital in order to come to a net number.
Because everything was put back in the proper buckets.
Yeah.
It should have
Right.
been to.
It's
Yeah.
just an accounting allocation. I mean,
Yeah,
it's
so
not-
it
Yes,
doesn't
it's
have
an
anything to do
accounting
with-
going from the health center against the hospital.
Well, if it was
But-
valid expenses, and if it was the hospital's responsibility, then the hospital should pay for it, end of story.
Right.
But the health
But
center
did
has
they?
not, the
Yes.
health center has not, asked to be reimbursed for those.
No.
It's really up to the health center to come to the hospital to be,
I would think Innovations Grantor would demand it.
It's already taken care of.
No, you're mixing apples and oranges, okay? Innovations Grant refused to pay for inappropriate expenses.
Right.
Okay, so they're not owed anything back because they didn't pay for it. So nothing has to get given back to